is a group of women advisors. We all own our own firms, and we are going to talk about all the things that we think are important for you to know about. Uh, Open enrollment season is starting now. We're probably well into the swing of it. So, all the things that you need to know about, we're going to debunk a few myths, we're going to answer some questions, and we'll be back at the same time next month to talk about it. So, I want to introduce myself. I'm Allison DePauli. We have Christine Shear with us from Chicago. We have Liz Antaya from Tampa, Pat Isaac from Baltimore, and Robert Flaherty from upstate New York. As you can see, we're a pretty diverse group and we have some pretty diverse opinions. And I think you'll find some interesting contradictions from time to time, which I think is very helpful. So to kick us off, Christine, you are going to tell us why the gag clause attestation of the CAA, Consolidated Appropriations Act, is so important. And we need to talk about this a lot.
Sure. Thanks, Allison. So I'm Christine Shear, founder of K2 Strategic. We work primarily in the Midwest, so our company's headquartered in the Detroit area. And I also want to let everyone know that if you've been counting, you've only see 5 on the screen, and you're wondering why we called ourselves the 6. No, we don't have a phantom member. Our 6th member is Nancy Giacalone, and she had another commitment today. So we'll hopefully all be here some of the time, and other times we'll have as many of us who can join.
Exactly.
So besides open enrollment, which is of course the one time of year that most people are actually paying attention to employee benefits, is the renewal and open enrollment season. The other big thing that everyone should be paying attention to right now, if you're not already, and there's still time, is the Consolidated Appropriations Act gag clause attestation requirement. Say that 3 times really fast. We'll shorten it. We'll use the term CAA because benefits needs another acronym, right? We use the term CAA, the gag clause attestation. And what I'm hearing is that there is so much confusion in the marketplace. There's a lot of, I don't believe there's any intentional misinformation, but I believe because this piece of the law is so new, it was just announced in February of this year, and this is the first year plan sponsors have to attest. I think there's a lot of confusion because it is still a little bit gray. We're still waiting for a few more points of clarification, but also because it's new. Every time we've had a law, let's think back to the Affordable Care Act in 2010. How many years did it take for the employer penalty portion of the ACA to actually take effect, and the reporting that goes along with that you do every Q1 for the prior year? It took a few years for everything to come together and get working. In this instance with the CAA, with the gag clause attestation, what the government has said is that you must go onto a federal website that is live now. You must go onto a federal website as a plan sponsor and as a plan. And I'll clarify what I mean by that in a second. But you have to go on and attest to the fact that your plan contracts, your agreements, that nothing in your plan is restricting access to essentially to quality and financial data. So claims data, individual claims data, macro data that an employer might be using to analyze their plan and make decisions about that plan, and ultimately then use that information to be the best fiduciary of the plan that they can be, which is required of them by ERISA law. And so the CAA, we view it as an extension of ERISA. It's putting teeth into ERISA law for health and welfare benefits in a very similar way that we saw 10-ish years ago for retirement savings plans like 401ks. So if you're not already paying attention to this, please make a big note to follow up with whoever your person or people are in this space immediately and make sure you get on top of it. And there's a lot of confusion in part because you have partners in this space. You have brokers, you have consultants, you have TPAs, PBMs, you have insurance carriers. You've got a lot of people, a lot of stakeholders that you're working with to manage your plan if you're an employer, a plan sponsor. And they're also trying to get their arms around it. And some have different interpretations than others, and some are taking different approaches to how they'll be supporting their employer clients than others. And that's where so much of the confusion, I think, is coming in. A lot of employers are receiving a notice from their insurance carrier or their TPA or their PBM, and it says, we're going to file this for you. And so they think, yay, I'm done. I don't have to do anything else. And that's, in fact, not at all the case. You are ultimately accountable for this. And what your next question needs to be, okay, you're willing to do this for me. Now tell me, is your part of the relationship, do we have any gag clauses in the agreements that we have between us and you? Do we have any gag clauses in the agreements between you and the providers in a network or within, any of the supply chain of the services being provided? So it's a big piece of the law. I think I've talked a lot and want to ping it off to my colleagues to share a little bit more, fill in some of the gaps that I haven't shared, and call me out if there's something that you think I misspoke on.
Oh, I don't necessarily. Thank you, Christine. That was awesome. But I think that now might be a good time to remind everybody that HIPAA was not designed to block the free flow of information. HIPAA was set up for the proper protection and ultimately dissemination of protected health information, which is, of course, data. Excuse me. So, HIPAA is not spelled GAG, right? I mean, that's what the carriers are going to always, say. It's like, oh, HIPAA, we can't. HIPAA, we can't. No, actually, HIPAA's pretty lengthy and goes into much detail about how you structure the proper dissemination of information and that free flowing of information. HIPAA was never enacted to block that free flow of information, which really now is needed to comply with the gag clause attestation.
Yeah, how many of you have received this response from any business partner in your health plan food chain? I can't share that information with you because of HIPAA, even when it's not personally identifiable, like even when it's not an individual's specific information. I can't give you this data because HIPAA prevents me from doing so.
Yeah, well, HIPAA, you de-identify the information. And then from there are procedures to transfer the information. But somehow everybody, those who are holding the data somehow believe that HIPAA is just this, umbrella of no. Yeah. HIPAA was never created for the land of no. HIPAA was created for the free flowing of information the proper way.
Right, to protect it. And
right, to protect it, of course.
Here's what's fascinating to me about HIPAA law is that if you're a self-funded plan, you are the plan and you're a covered entity. If you have an insured health plan, you're a business associate and everyone's a business associate in that relationship. Either way, you have responsibilities, but the free flow of information that you reference, Robin, is supposed to be allowed when BAAs are in place, the business associate agreements are in place between the appropriate associates for treatment, payment, and operations purposes, TPO. And all of the work that employers are doing and that we're doing on their behalf and in partnership with them and their employees is for exactly that, treatment, payment, and operations of the health plan. I have a favorite phrase that I've shared with some people recently. It might be a little cheeky, but that's okay. And that is, please don't use a law to tell me no if you don't understand that law. Oh, and
it's exhausting.
It's exhausting. Yeah,
it is. It is. It's a whole separate. Podcast to discuss, the different procedures that need to be in place. But this is not a plug, but I did write a chapter once in a book that goes into quite a bit of detail on how to set up those procedures to get that free flowing information going. Because at the end of the day, protected health information is your underlying data, and you need that data in order to make informed decisions and to know which strategic cost containment levers that you need to use to ultimately manage your top 3 business expense.
And I want to add something to that. Christine, great job, and Robin as well. These are terrific topics that, our clients need to be aware of. And one of the things that is probably most disturbing to all of us, and that's why we've come together as a group to make a difference, is the fact that, all of these no's that we have actually received over the years really make our job harder, because we are fighting for our clients. We want them to have the transparency, but also as consultants, we need that information in order to fight really hard for them to make sure, hey, is the pricing fair? Do we need to do something from a cost containment measure? So it makes it really tough. I always ask, clients, are you running your business not knowing your numbers? And the answer is no. But really it is yes, simply because most individuals are not aware of what their actual true healthcare cost is. And that's why we need to make a difference. That's why we truly believe that the new CAA gag clauses and other transparency acts and HIPAA were very, very important to, start initiating so that we can get the data so that we're able to better help you.
Yeah.
Yeah. It's interesting that HIPAA was put in place to make sure that the information got where it was supposed to go, but
And
some
nowhere else. That's
sorry.
important to talk about too. It was designed to make sure that the information got where it needed to go and nowhere else.
Right.
And somehow that got to be only nowhere else, which is not to the benefit of the employer.
Exactly. Yeah.
And we have somebody that really liked your is not spelled gag.
Yeah.
And Nancy is tuned in to say hello.
Oh, yeah.
Yeah, Nancy, we miss you. And I just wanted to make a quick point that while this sounds like it's just another rule, another law, another something employers have to do, it really is for the benefit, right, of the employer ultimately to, like you have all said so well and eloquently, to be able to get the data that they need to make those informed decisions, have actionable data. So one of you might want to talk about the penalties, because as we know with ACA, there was an individual mandate, but as soon as they got rid of the teeth, right, the penalty, there's still so many people without health insurance because there's no teeth to this. Is there teeth to this?
There are teeth to this. Liz, why don't you tell us what those teeth are?
It's $100 per day per employee that you haven't complied. So it can get pretty costly pretty quickly if you have a large employee base.
And that is an ERISA violation, correct? Which means the penalty is an ERISA excise tax?
Right.
And Robin, is that personal to the plan sponsor, or is that something that the company pays?
Well, that would be the company. Wouldn't it be the plan sponsor is the company.
But it pierces the corporate veil.
Yes.
I'm sorry. You're just catching me off guard because it's it's clearly the responsibility of the company. And what's interesting about ERISA is, it's been 49 years that these fiduciary laws have been around. It's just that now, now we have the tools, now we have the rules and the tools. I think that, employers were not held to the same standards with their health plan that they are with their 401k plans, because, there weren't these, again, I just believe that the transparency laws was such a gift to the healthcare consumer, and it's our job to make sure that gift is used properly.
Yeah, and the other thing too, I want to mention that, I'm sure that you're all aware that it took effect actually on 12/27/20. However, the first compliance attestation is due this year, which is 12/31/23. And then once a year, they have to make sure that they are in compliance with that. So just wanted to bring that out.
Yeah.
So, and Pat, just to confirm, they do have to file for 2020, 2021, and 2022 at the end by December 31st of 2023.
Yes, that's correct, Allison. Absolutely.
Yeah. And then annually going forward.
So
let's talk a little bit about, what a gag clause is or potentially could be. This is definitely an area where I think I personally believe we're going to see this litigated, just like we did with some of the stuff in the, retirement savings plan legislation. And we're also expecting some more details from, the federal government, the DOL, et cetera. But we're already facing gags, and we already know that gag clauses exist in many of these contracts and agreements, regardless of where you're insured or self-funded. It doesn't matter. we know that there are gag clauses that exist today because we know that, I think it was Pat that spoke about this earlier, that when you when you send a question out to a carrier partner or a TPA for data, many times the answer is no. And sometimes the answer is no because your group is in the 50 to 99 employee segments, and we don't share claims data with those clients. It's a business practice of a carrier. It's not a legally based thing. It's a business practice of a carrier. And when you sign a contract to work with them, they have administrative practices in place that ultimately drive, your access. I believe, and I'm really curious on your opinions about this, and I believe that this law gives us the teeth to get that data for insured plans as well as self-funded. There's been so much conversation about the data around self-funding. We've got lawsuits galore out there right now, like I think the Kraft Heinz one is a really good example that pops into my head. There's a lot of litigation from self-funded plans, but what we haven't been talking about, and I really think we need to bring to the forefront, is the opportunity, to use Liz's term, that this law gives employers, plan sponsors, whether you're an employer, a labor fund, a MIWA, whatever you are, an association, you're a plan sponsor. It gives you the opportunity to get data, because the gag clause attestation requirement doesn't say only employers that have 100 or more full-time employees have to attest,
Right.
or only employers that run a self-funded plan have to attest. It doesn't say, there's none of that qualification. It's, if you are running a plan, if you're a plan sponsor, if you have to file. And it even goes so far as to actually pull in some public sector employers that, historically under traditional federal ERISA have, been a little bit distanced from. So this law is all encompassing. If you've got a 40 employee group or a 4,000 employee group, you have to comply by the end of the year with this. And you can do one of two things, or a hybrid thereof. One is you can read those emails that are coming in that say, we're going to sign off for you, and say, oh, great, done, check. You can, two, lean into your partners, like the one that sent you the email that says we're going to do it for you, and say, okay, great, thank you. If you're going to do this attestation and it covers things for me, are you also documenting in writing for me that there are no gag clauses in any of our agreements or the agreements that run my plan, and are you also willing to share those agreements with me so that I, as the ultimate accountable party, the plan sponsor, has that information to make sure that I'm comfortable that we truly are in compliance with the law. Or you can do something well in the middle of that. But I think those are our two boundaries right now that we're dealing with, logistically speaking. But I would encourage people to think beyond logistics and ease and lean into the legal side of the law and start to understand, what does this really require of you, and how can you get ahead of it, not only for logistical reasons, those filings, but most especially for the strategic reasons and your ERISA legal reasons of running your plan.
Yeah, I'm sorry. Go ahead, Allison.
Since we're on the subject of ERISA, the gag clause attestation is really the last component of the CAA. Do any of you want to address what the first few were? Because I think it might be worth going over those at this moment as well. So the first one was the broker compensation disclosure. And I got to tell you, I've seen some really interesting broker compensation disclosures.
Well, and it's service provider disclosures too. So it goes beyond just your broker consultant.
Correct.
So funny story. For years, I had a big three, I'll call it PBM, on one of my self-funded clients in place. We inherited it. And every year when we would do our annual meeting with them, I would say, okay, now how much did your company make on this plan last year? Through all of your revenue sources, because there was no PEPM administrative fee. How much did you make? We want to know, for reasonability purposes. And every year they had a legal or an internal practice reason why they wouldn't share it. But every year I wanted it documented for that. So now that the CAA is in place, service providers have to provide their compensation information. I believe that same PBM is also still not providing that. This is probably something that will ultimately get litigated, but it's a fascinating piece of the law, and I think a lot of employers still don't have compensation.
I don't think they do either, and I think for even a pretty savvy CFO who is typically the plan sponsor, at least on a self-funded plan, they're typically the plan sponsor. They get a two-sided document that said we made this much here, this much here, this much here, and then it says, and we may make a certain marketing fee that does not impact your costs. And they just kind of go, okay, I checked my box. So what do you all think about that? We may make a certain marketing fee that does not affect your cost clause. Nobody wants to take that on?
I
Well, no,
will take it head on. I don't know if you guys are comfortable with this because we didn't talk about this, but let's talk a little bit about some of those fees that we're aware of that are buried, that are marketing fees that don't affect your cost. I'll go first. So one of the marketing fees that don't affect your cost that I know is in existence today with some national broker consulting firms, I will never name names, is related to pharmacy benefit management procurement, PBM procurement practices. So of course, many firms have a PBM practice. Great, pharmacists on staff, clinicians, business experts who can help you evaluate contracts, all of those things. But what most people don't realize is that those practices are doing a couple of things. One of which is if there's a PBM that's not in their inner circle wheelhouse where they're used to getting proposals from, let's say it's a newer PBM, and they have a client that wants to evaluate them or they want to evaluate them for a client, that PBM oftentimes is required by that pharmacy benefit practice to pay to play. Meaning they have to pay that consulting firm a large fee. And when I say large, I mean unreasonable, in my opinion, as someone who's been a consultant for over 20 years and in the industry for 30. I'll give you an example, like $50,000 for a 300 to 500 employee group that they then have to attest they cannot pass along in the fees to the client. So it's free money, if you will, to the firm that this PBM has to pay if they want to play with that consulting firm. And that consulting firm is holding them hostage to that client. So, or to their client base, you have to use our practice. And then I believe that's one of those fees that is a marketing fee that doesn't impact their costs. And I think that's one of the ways that they're getting around it. And I'll tell you, if I were sitting in the CFO's chair, I'd be picking up those covers and making them share that information with me. I would not let that be hidden because that impacts my objective access to the markets that could potentially help me. And that's my fiduciary money or my fiduciary responsibility.
I like to say that it doesn't matter what you pay as long as you're comfortable defending yourself. And if you don't know what you're paying, you can't defend yourself.
Yeah.
Good point.
What other fees are you all aware of that might be a part of the marketing fees that don't impact your costs?
Well, the other part is, obviously with many of the larger firms out there, and like Christine will never mention names, they're getting pretty big bonuses out there. And those bonuses were never disclosed, and the question is, does that bonus actually drive that client to that carrier so that the bonus continue to increase? That there's a huge unfairness, especially now in the market today where margins are actually getting squeezed. Employers, are being affected by wage inflation and other aspects. And here, who they feel are partners, should be good partners, are not fully disclosing what they're getting paid for their services.
I know there are also fees, and this is in the forefront of publicly right now, that, and we've known this for decades, those of us that have been in the industry, which I think is all of us for a while, a lot of things that have been included in the claims number. So if you get a monthly report that shows, here's the claims on my medical PPO plan, and here it is on my medical HDHP plan, most of your network-based plans have had fees included in there. And you have to ask to have them broken out. And then after you ask, you also then have to make sure that it's being that it's being done. Ultimately, you have to audit wherever you can on self-funded plans. Of course, you have to be auditing. But, we had a situation last year with a TPA where we went to the TPA, just like we always do, and say, give me a summary of how much you're making, all of these line item fees with these other vendor partners. How much of that are you keeping versus how much is going to that vendor, that other vendor? And initially we were told, well, here it is. And there were like 2 of the 8 or 10 fees that they said all of it was going to the other partners. And then year 2 this year, fast forward a year after the CAA is getting a little bit more press and play, all of a sudden we find out that every single fee they were taking a piece of, and have been for the last couple of years, but they didn't disclose that when we requested it before. So you really have to bird dog this stuff. And to Pat's earlier point, it takes a lot of time. But
I never named names either, but I was had a self-funded case where we have a rental network for their physician and ancillary services, and it had its own contract. And then one year it didn't have its own contract. It had a separate agreement that needed to be signed, and the addendum was from a separate document. And literally we figured this out because the first 2 pages were one set of 1A, 2B, whatever. And then the 3rd page of the document was a completely different legal structure. That is how close you have to look at it.
Yeah.
And when I asked, I said, I'm not signing this. And they were like, okay, then you don't have access to the network. So we're not with that TPA for this client any longer. That's one of many reasons, but it's right down into that detailed kind of stuff. Mm-hmm. And we have a question from Thomas Laster who says, good question from a few questions ago, and contingent comp needs to be disclosed. Anybody want to take on what contingent comp is? Okay. Contingent comp is when you place a block of business and how much of the business stays and how much you grow that book. I think the logistics of it depend on which carrier you're with, but typically it's considered override or bonus compensation. Mm-hmm. And falls under that, we may receive an additional marketing fee that does not affect your costs. I know that's a pretty simple conversation. Maybe we'll take that one on another day, mm-hmm. but typically it can be a rather large number that is not disclosed to the client. And I want to also point out that it may not be disclosed to your advisor either.
Yes.
That is a touchy subject, but a lot of times you may have an advisor that works in a large firm and they actually don't know what the contingent compensation is.
It's a fact. That happens.
We need to be reasonably fair here.
So bottom line, good news is there are rules and laws now that can stop these games. Mm-hmm. And now and reveal the layers and the players and, everything that goes into the pricing, because you can't manage what you can't measure.
Yep.
Exactly. There are 2 major areas, that I think we talked about it today, that we often see, the other side who we're trying to negotiate for our clients against. Basically, they hide behind a HIPAA card and they don't really need to. When it comes down to HIPAA, we don't want to know that Pat Isaac is the problem child or has a challenge, right? All we care about is tell me what the challenges are so that we can mitigate that risk. The second one is that, things are proprietary. Our rates are proprietary. That's what these gag clauses will do. It will eliminate some of those, doors that could not be opened until the laws actually passed. So
I want to move on to our second subject of the day. And Pat, I was hoping you would kick us off on that. And I want to talk about what these costs do to what people are paid, how people manage their talent, what impact that actually has on a business, and how often that is overlooked.
Absolutely. Thanks, Allison. So, one of the things that you often align are benefits with talent, right? And those two go together in sync. And so, I don't know if many of you have actually looked at the recent U.S. Bureau of, Labor Statistics, but basically, right now, what we're in, it's the highest level over the last 2 years of having a very high turnover and job openings. And so now how does that affect benefits? It's a huge effect because you have to think of how you have handled your benefit structures over the year. And in many employers, in order, they know that there's an important aspect of, offering benefits, but there's only so much cost in that bucket that they could actually afford. So many brokers, not so much consultants, brokers basically would constantly dilute their benefit structure to lower the rate, increase deductibles, co-insurances, is other things. It no longer became a value to an employee. When they needed care, there's a lot of out-of-pocket costs, including the premium costs that they have to pay. It becomes unaffordable. And then what happens is it also removes any type of, it actually causes barriers to care. So what employers today, there are a couple things that are happening that HR, I know, are very focused on. So obviously inflation, wage inflation, and then the other aspect is, the population out there is changing in the workplace. So we're changing generations. And so we can't continue to do, it's that whole Einstein thing. You can't continue to do something and expect different results, the same thing. So now is the biggest time where employers, should really be looking at their benefit structure. How is it aligned with their demographics? How is it aligned with the generations? What are the needs, within those generations? Simply because these trends will continue to go up. You will continue to see talent diminish if you're not able to provide the benefit structure. But then the other underlying problem is what we were talking about earlier. What is your cost? What's your real cost for benefits, and what are you really offering? And having someone really pull that, onion, peel it back. You deserve it as an employer. But that's something that I wanted to share. Allison, did you want me to add anything else, or anyone?
I think it's a really important way to frame it, because so often when we talk to HR leadership or senior leadership in an organization, benefits is like, yeah, I don't want to deal with that. Just get it to budget. But there are real challenges to getting it to budget. And I think we would all agree that there are more cost-effective ways to get to budget than to keep diluting benefits.
Yeah, you raise a good point about, I'm sorry, Christine, were you going to say something? You raise a really good point, Pat, about the barriers to care. I know that I developed my passion for what I do, trying to help a company manage a top 3 business expense, because if we're helping to manage that expense, then ultimately that's being a benefit, overused word, to the employees, because I've delivered bad news with a smile for 26 years, and it starts eating away at you, and you need to be part of the solution. There's so much misinformation. There's just so many tricks that are played, and these are some of the things we talked today about, the ones we know about. One thing I look forward to seeing with the gag clause attestation process is the ones that we don't even know about that are happening, that start emerging and being revealed.
So we have a question. Oh, sorry, Pat, go ahead.
No, and I see it. Kristen, thanks for your question. You're absolutely right. I mean, with regards to benefits, there are core benefits with our, major medical, but what your new generations are looking for are things that are different. and lactation, privileges, as well as fertility benefits, freezing embryos. I mean, I was at a wedding this weekend, and the cocktail conversation was around from employers, in that little round group that we had. Like, Pat, what do we do about these new employees coming in? And now they want fertility benefits. I said, you have to offer it if you want skilled talent. So there are other things that should be looked at, and not necessarily do you have to pay 100%, but you at least need to explore. But I also want to add something with regards to the barrier to care. We have to keep in mind that if you keep putting something off, it's going to blow up. Okay. So if you continue to dilute your benefits, and then you have this employee who is omitting care simply because they can't afford to, whether it's not taking their medications, not going into the doctor's office, you're going to have a catastrophic situation, which is going to affect your productivity. It's going to also affect your bottom line. And so that's why it's really important. We all believe in this group, especially, on making sure that you don't continue to go to the normal care because your Blue Cross, your United, your Cigna, your Aetnas, and only feel that they're the only ones that can offer coverage. Allow us the opportunity to help you really redesign what is the most appropriate coverage for your group.
Right. Even if you still, sorry, go ahead, Allison.
I think that's a really important point. There's a recipe for designing a health plan, right? But every chef is a little bit different in how they execute that recipe. And I think that every employer is a little bit different about what is important to them. And when you're out of that, we call it VUCA environment, you can design things that work for you. And because the other side of the lactation and fertility benefits is menopause benefits. All right. So can you imagine going to a large carrier and saying, I need this and this, and you're going to get looked at like you have two heads. Whereas when it's your own plan, you can create something that works for you. And again, you don't have to pay for it all. It can be something that there's a cost share with, but people need help with these things.
Yeah.
Well,
And sorry, Christine, go ahead.
I was just going to say, we've all been doing this long enough that we know, we've lived the paradigm and the shifts of the continuum of employee benefit plans, healthcare plans. When I first started in the industry, HMOs were really coming into vogue and they were super common. There were some different funding approaches, but they've come back. But HMOs were really prevalent. The difference between an HMO 20 years ago, though, and an HMO today is that the network in an HMO was much narrower. And the premise behind it, the philosophy behind it, was that we're going to find the highest quality providers within communities. And if they'll agree to take capitation, a fixed monthly fee for their services to manage the health and the relationship with their patient, i.e. primary care doc, then, they're a good fit for us. But over time, what's happened, this is a good why for people that don't know this, is that those networks have become much more sizable and not as big as a PPO network, but comparable, in many markets. So if you live and or work in markets where HMOs are still very prevalent or point of service, which has been making a resurgence the last couple of years, that's what's happened. But unfortunately, they're not all capitated anymore. There are some capitated arrangements, but there's a lot more fee for service that's going on in those plans. And when you start to build your networks with providers who don't meet quality standards, and by quality standards, I don't mean they were willing to fill out our form and submit it. I mean, their quality was actually truly vetted. They really do perform these services regularly and to a high level of success, and have the appropriate educational levels. That's a huge part of our problem. And I feel like after we've been along this continuum, we don't have any place else to go. There's no new shining plan that's coming out for us. We've already taken high deductible health plans with HSAs and pushed off far too much onto plan members and employees. So we really do, employers really do need to lean in and start having those conversations that you're talking about, Pat and Allison, to see what else is out there. And okay, even if my costs are going to go up by a small amount, maybe we would allow each year, how can I then manage that cost so that I can put in some of these other things? Maybe better control the things that are out there and put in other things.
Yeah, and Christine, I want to add to that because I think this is really important for people to understand is when you're working with the BUCAs, they have to work within a box, okay? What happens and where we can actually differentiate our organization is, we'll give you an example. If someone's not feeling well, they make a doctor's appointment, they go to the doctors, it takes a couple weeks sometimes to get there, right? Or they call Teledoc. Well, what if we told you that we were able to bring care to your employees' homes and take care of their family members as well as your employees within a 24-hour period, if not sooner? That makes a difference. That removes that barrier of care. Those are the kind of things that we can do and really brings the value of healthcare much greater. It brings it up versus waiting for someone to give it to you. We're proactively managing it on your behalf.
There is a company that brings urgent care to the home.
Yeah,
Easy Access MD.
Yeah.
exactly.
Yep.
Yeah.
Yep.
And Easy Access MD is quite a good vendor. There are others if they're not in your area because they're not quite nationwide. They do an excellent job, and there are a myriad of ways to deal with that. I want to post this link to the MetLife employee benefit survey.
Yeah.
That, Robin?
Yeah, MetLife has they've been doing a benefit trend survey for better part of 20 plus years, and what they've been talking about since the pandemic are these benefits called emerging benefits, and that's what Dr. Dickerson was mentioning in the chat about the lactation and fertility benefits. Is that really, employees are looking for companies that support them with the business of life, that meet them where they are and help them with the life that they're living and the challenges that they're facing, with just living life. And to your point, Pat, diluting benefits, increasing the deductibles and out-of-pocket expenses is just really creating, for a lot of people, barriers to care. And MetLife has been, this survey I always thought was really good. And it just has a focus on these emerging benefits. And really, it's the holistic person, and that your benefits, the benefits program that you put together, really addresses the holistic person that comes to work every day. And because they are bringing to work, even though, I was brought up professionally in the 80s and we were told you leave everything at the door, right?
You bring your imposter self to the office, Robin.
Right. But, that's not real, and so, I think that there are some good things that have, I'm old enough to remember the way it used to be, but I'm young enough to know it wasn't right. And I'm happy to see some of the changes. But no, they do a really good job with talking about the holistic person. And I believe that employers that really want to be an employer of choice, should pay attention to that. But how do you afford that? You afford it by having the transparency in your current program to know where you're spending and where you can redirect your budget.
We have several of us have a mutual acquaintance who runs a rather large health plan, and they had made some changes to the plan. They removed one of the large hospital systems in their area because they did in fact have data, and they saw across their population that maternity care, both traditional and C-section deliveries, were about 4 times as expensive at a particular hospital system with no difference in outcome. That is what the gag clause attestation ultimately means you will have, is you will be able to see that so that you can guide people to an appropriate place for care that is the right price. And right price, right time, right patient is typically not that expensive, even for quite serious illnesses. So I think it's a good thing to remember. And then that with the savings, that allows you to do a whole host of things that you might like to do for your population to help with talent management.
Except when you're outside in a more rural environment. Most urban and suburban environments have more than one health system. Now, we all know that the number of those systems has shrunk dramatically, a lot of gobbling up, and that's a whole nother podcast.
Yeah.
But maybe two.
Just to.
But I think Allison makes a fabulous point. It's the data that's going to allow us to be that allows us to be strategic for employers and to help them fulfill their ERISA fiduciary responsibility to make sure that their participants are getting a fair shake. Because if they're paying for employee A to go to hospital A and have their baby there, and that costs double or exponentially more than it costs at hospital B for the same level of quality or the same outcomes, are they really meeting their fiduciary responsibility?
Well, as Dave Chase, co-creator of Health Rosetta, says, if you pay, you should have a say.
Yes.
And another myth is that the payers of healthcare are the carriers. It's not. It's the employers and the employers. Excuse me, the employers and the employees. Period. Those two demographics are the payers of healthcare.
At the end of the day, the way to look at it is, would you ever go in a supermarket and you only have $100 in your pocket and just keep picking up things without knowing what the cost is? None of us would do that. So that's how we have to kind of look at healthcare in the same manner.
We got another link. The Power to the Patients just came out with a hilarious video about estimates.
Yeah.
Someone goes in for coffee and they're like, yeah, we don't have any prices. We have estimates.
Yeah.
Yeah, no other industry works that way, right? And some of these solutions in our toolbox that we bring, right, is obviously to reduce the employer spend, but it's also, so much of it is about educating the employee. And I'm thinking in particular on MSK or musculoskeletal sort of procedures that cost plans so much, and at least my plans. And I think it's so prevalent out there, the total hips, total knees, and back surgeries, right? I mean, the number one result of a first back surgery is a second back surgery. And so I think we've all learned through the books that are circulated in our people, right, that so many of the procedures are done unnecessarily. And employees don't know this. We trust our doctors and our providers, and we want to be able to trust them. But I think we come to a place where we have to be informed and educated.
We had a situation last week where we had somebody that was prescribed a tier 4 medication, which means it requires a prior authorization. And the member was very upset that they couldn't just get their medication. And when the HR person talked to the member and said, well, this is what has to happen, she said, well, I don't want to take this medication anyway. Can I take something less expensive? But she never said that to her doctor.
Right.
And I think we have to have better conversations about change management and conversations about that. And again, I think we could have 5 episodes on that because I don't know that we all manage the change very well or understand what the impact of a change is to a human being that is just trying to live their life.
Yeah.
So we have just a couple of questions today. I think we're close to the hour, so maybe it's a good time to move on to questions. So the first question is about compliance. And I think we've all had this question, so it's a great one for us to address today. So Liz, I'm going to ask you to answer this one. What are the penalties for non-compliance? And not just for the CAA, but we have a whole host of compliance issues and the penalties are remarkably similar.
It's probably pretty much $100 per employee per day across the board, isn't it?
It is. ACA, COBRA, CAA.
There's one of the ugliest ones, you may or may not know this, is sorry, I lost my ability to speak. The fine or the penalty for failure to file your 5500.
Mm-hmm.
So, health and welfare benefit plans that have 100 or more participants at the beginning of the plan year have to file a 5500. It's really that's the simplistic, way of looking at it. And if you don't, the penalty this year, I believe, I wanted to pick this up when I thought of it, it's either a little over $1,500 a day or $2,500 a day. I know we ran the numbers for a new client who unfortunately had missed a filing with a prior broker, and told them what the potential penalty for that was, and it was, I want to say, like $70,000 or $80,000 a month for every month that they hadn't filed. Now, of course, you can go mea culpa and try to get some grace through their grace program, but that's not guaranteed. So you have to go hard.
The penalty is, I just talked to a prospect about this because they have never filed a 5,500 form and they have 300 people on their plan. Penalties up to $25.86 per day for each plan form 5,500 with a willful violation resulting in additional penalties. $25 a day, max $15,000 for returns before 12/31/19, and $250 a day up to $150,000 for return for 5,500s that need to be filed as of January 1, 2020. So that is no joke.
No. And I'm going to add a couple things to that. There is a delinquent, as Christine mentioned. So if you haven't filed, as you know, in a few years, you may want to go ahead and work with an expert who can basically do a blanket delinquent filing for you.
Yep.
That's one. The other thing too is this is also a misconception. People don't understand, do I or don't I file 5,500? It's the first day of your plan year. In any of your plans, if you have 100 employees or more, you do have to file a health and welfare 5,500 form. What we always recommend is have a wrap document. That wrap document allows you to actually have a consolidated filing done. So rather than having individual filings, so those are the things that you have to keep in mind. You have 7 months, okay, after your renewal period ends to file it. And if you can't do it within 7 months, you can actually request for an extension. So I just want to clarify that because some people, have some confusion around it. And I don't know if anyone wants to add any additional items.
It's an extension, just to add that.
The forgiveness program is pretty cost effective, and it really is better to ask forgiveness, pay the fine. It's really not that much. Get the things filed and move on.
Yeah.
Yeah, you just get one of those.
Yeah. Just don't try to hide it.
Yeah.
And don't get confused. 5,500 filing is for health and welfare. And there's also another one for your retirement plan. So two separate things. So I just want to make sure. These are things that we know have been problems.
Yes. One last question. Why did we start this in the fourth quarter?
Because we're cray.
Yeah.
No, I think it's Christine, you jump off that one because we talked about this before we went live, and I think that's the best answer. Go ahead. Do you remember what you said?
That we're cray. No, I think one of the reasons is that, first of all, we talk all the time. We're a group of industry advisors who talk regularly, share ideas, talk about important issues, important topics in the industry. And we were seeing a lot of the same common questions coming in and the same common issues, which we, of course, also see on LinkedIn. So we've been talking about doing this for a while and decided to do it in the fourth quarter because we were ready, and also because people are paying attention in the fourth quarter. Sadly, this is benefits quarter. A good portion of employers are really focusing on their renewals and their open enrollment processes. And so we wanted to take the opportunity while we had a bigger audience potential to start these really important conversations. And also for me personally and professionally, this CAA gag clause attestation is incredibly important. And that stuff is due at the end of this year. And having that out in front of as many people, many employers, plan sponsors as possible is super important.
I think we all agree with that. And I think we will leave it there today. Thank you, everybody, for joining us. And we will see you the first Thursday in October. First Thursday in November, same time. See you then.
Bye.
Bye, everyone. Thanks for your time.
Thanks for joining.